Hi, I'm Kristen Burt for LifeScript.com. 1 in 5 women are migraine sufferers. Why does it affect women more than men? Learn more in our LifeScript interview with migraine specialist Dr. Susan Hutchinson.
I think one of the most interesting things that came out of today's seminar is the fact that 1 in 5 women are sufferers. I'm going to raise my hand because I'm one of them. I was astonished at how large that number was.
Yes. Well, I think what we found is probably that's due to the hormonal changes that women have compared to men. Because when you look at migraine, it's equal prevalence in boys and girls. Once women hit puberty, there's a ratio of about 3 to 1, 3 times more women experiencing migraine than men. And so we think it's the ups and downs in hormones that women experience.
That's interesting. I also want to know, is there a hereditary connection? Because my mom had migraines, and then when she got pregnant, they ceased. My brother had them growing up. I didn't get them until I hit probably about 25, 26.
Absolutely. We think most migraine patients have inherited as a genetic predisposition.
There we go. So what if someone is suffering from migraines, what is the first step that they should take besides seeing their doctor?
I think it's to start keeping a calendar or diary. I think you want to start seeing what the pattern of your migraines is to, for example, your cycle if you're a female. What about relationship to foods that you're ingesting, amount of sleep? So I think keeping a calendar or diary and trying to identify what your triggers are, because that can be a huge step towards helping to prevent the headaches in the first place.
What I think is interesting, and one of my triggers is gluten. And I have a lot of people that don't believe that there is a connection between my migraines and gluten. They think I'm faking it. Have you seen sort of like the rise of preservatives or other food triggers in your migraine patients?
Absolutely have. And one point about gluten, some people think it has to be an allergy to gluten. No, it can be an insensitivity, or a sensitivity to it. So patients can get allergy testing and say, well, I'm not allergic to gluten. But I think every patient has to figure that out for themselves. And so I think for some people, going gluten-free can be tremendously helpful. For others, there may be other things that they need to look at.
And from most of your patients, do you find that monitoring diet, monitoring stress levels, what is the most helpful thing overall?
I think overall lifestyle, and I actually identify 6 things when a patient comes in I want them to monitor, and that is their amount of sleep, and not just amount, but quality of sleep. I want to know what's going on with their diet, particularly are they getting enough protein? Protein is huge to keep the blood sugar more even. What about water intake, caffeine intake, alcohol, and just stress? So I think all those things are very important.
You talk a lot about the stigma, and I think, we always worry about the physical aspects and what's triggering our migraines, but there is an emotional and mental health aspect to it. What do you recommend to your patient?
Well, I think to accept the fact that they did not do anything wrong to inherit this condition, but they're not completely out of control with it. In other words, okay, yes, so I've inherited it, which, in my case I have as well as you have, but let me control what I can. While I may not be able to control the weather or control the fact that I was born female, what can I control? My stress level, my amount of sleep, what I'm putting in my body, water, proper nutrition, exercise. So let's control what we can. And then again, the goal is to live our life as free of migraine as possible.